Hello students, welcome back to Easiness, where nursing education made easy. So mainly today with this session we are going to discuss regarding the behavioral science, so the bioscience. So under this anatomy, physiology and then microbiology, which will be helpful for your upcoming exam. So let's start about today's sessions, and mainly in these sessions we are going to discuss regarding the most important questions which are gradually coming in the exam paper. Okay, so चलो शुरू करते हैं आज का सेशंस. सो पहले हम लोग डिस्कस करेंगे रिगार्डिंग द मीनिंग्स. ओके, सो क्या है एनाटॉमी, मतलब क्या है? एनाटॉमी इज द नथिंग बट इट्स अ ब्रांच ऑफ साइंस व्हिच डील्स विद द स्ट्रक्चर्स ऑफ द ह्यूमन बॉडी एंड इट्स पार्ट्स. ओके, सो दैट इज कॉल्ड एनाटॉमी. सो नाउ कम टू द फिजियोलॉजी. सो फिजियोलॉजी इन द सेंस लाइक a branch of science which deals with the functions and process of the body and its parts. Next come to the microbiology. So what do you mean by the microbiology? It's a branch of science which deals with the study of the microorganisms including bacteria, virus, fungi as well as the protozoa. Now come to the immunity. So what do you mean by the immunity? Immunity is nothing but it's a body's ability to fight against the infections, disease or any kind of the microorganism or harmful substances. Now come to the adduction. Adduction is nothing but it's a movement of the body part towards of the midline of body. Now come to the fertilization. So fertilization is a process by which a sperm cell is going to fuse with and mature ovum or the egg cells and form a zygote. Now come to the cytology. Cytology is nothing but it's a branch of biology which deals with the study of the cells, their structure, functions as well as the chemistry. So that is called cytology. So cytology is nothing but it's a branch of biology which is mainly regarding about the cells, their structures, their functions, everything. Now come to the flexion. So flexion is nothing but it's a movement that decreases the angle between two body parts at the joint point. So that is called flexion. Now come to the digestion. Digestion is a process of the breaking down of food into the simplest substances which can be absorbed and used by the body for preventing or as well as for managing all the micronutrients which all are required for our daily basis healthy lifestyle. Now come to the ovulation. So ovulation is nothing but it's a releasing of a mature egg from the ovary into the fallopian tube. Now come to the larynx. So larynx is a part of our respiratory system which is located in the throat that houses the vocal cord and it's going to involve in breathing, sound productions and protecting the airway which is during the swallowing, especially the food. Now come to the spore. Spore is a resistance which is dormant structure formed by the certain microorganisms such as bacteria and fungi to survive the unfavorable conditions. Now come to the deglutition. So deglutition is nothing but it's a process of swallowing food or the liquid from the mouth into the stomach. So that is called deglutition. Now come to the pasteurization. It's a process of heating the liquid, especially milk, tea, for a specific temperature for a set period of time to kill the harmful microorganism without changing the substance basic qualities. So that is called pasteurization. Now come to the micturition. Micturition is nothing but it's a process of the expelling urine from the urinary bladder through the urethra. Now come to the antigen. So antigen is a substance which triggers as an immune response, especially the productions of the antibodies. Now come to the salivary gland. So it's an exocrine gland in the mouth which produces and secretes the saliva to aid in indigestion and keep the mouth moist. Now come to the neuron. Neuron is a basic structural as well as a functional unit of the nervous system which transmit the nerve impulses. Now come to the menopause. Menopause is a natural cessation of the menstruation and at the end of the woman's reproductive system, typically occurring between the ages of 45 to 55. Now come to the fill in the blanks. Okay, so first question is dash is known as a muscle gland. So the answer goes to pituitary gland. Dash is the longest and the strongest bone of the human body. So the answer goes to femur. What is the best method of the sterilization? So the answer goes to autoclaving. The middle layer of the heart is called dash. The answer goes to myocardium. pericardium. The outer layer of the uterus is called dash. So perimetrium. The first cranial nerve is a olfactory nerve. The hospital acquired infection is called dash. The answer is nosocomial infection. Typhoid is caused by dash Salmonella typhi. Then the lifespan of the RBC is 120 days. Now dash is the hormone secreted by the thymus gland. So the answer is thymosin. Dash is called as the powerhouse of the cell. The answer is the mitochondria. Then cholera is caused by the dash Vibrio cholerae. Next, the space between two lungs is called as dash. The answer is mediastinum. Then the membrane covering the brain and spinal cord is called as dash meninges. The bone are connected to bones by dash, that is called ligaments. The suprarenal gland is otherwise known as dash. The answer is adrenal gland. The adult human body consists of dash number of the bones 206. So total number of the bones in our human body, especially for the adult person, that is 206. So dash is the structural and then functional unit of the kidney. So the answer goes to nephron. The enlargement of the spleen is called dash. The answer goes to splenomegaly. Now come to the true or false. Okay, so the spinal cord lies outside of the vertebral column. So the answer is false because spinal cord lies inside of the vertebral column. Next, the progesterone is hormone which produced by the corpus luteum. The answer is true. The mandible bone is the only movable bone of the skull. Answer is true. Next, the autoclaving is a method of the disinfection. The statement is false because autoclaving is a method of the sterilization, not just for the disinfection. Next, nucleus is a powerhouse of the cell. The answer is false. The powerhouse of the cells is known as a mitochondria. So the cardiac muscle is the voluntary muscle. The answer is false. It's an involuntary muscle. The pacemaker of heart is situated in the right atrium. Yes, the statement is true. So pacemaker is also known as a SA node or the sinoatrial node, which is present inside of the right atrium. Now come to the next question. The pH of the blood is 7.4. Yes, the statement is true. Heart is situated in the mediastinum. The answer is true. Optic nerve is the second cranial nerve. The answer is true. Stapes is the smallest bone. The answer is true. Cerebrum is the largest part of the human brain. Yes, the statement is false. The cerebrum is the largest part of the human brain, not the cerebellum. Next is the pulmonary artery carries the deoxygenated blood. Yes, the statement is true. Then the rabies is a zoonotic disease. Yes, the statement is true. Vagus nerve is a 9th cranial nerve. That is false. Vagus nerve is a 10th cranial nerve, not the 9th. 9th is the glossopharyngeal nerve. Now come to the next, that is structures of the heart, like essay questions. Okay. So heart is nothing but it's a muscular as well as the hollow organ which is mainly located in the mediastinum spaces between the lungs, and it's also about the size of the fist, and it's also going to enclosed in a protective sac which is called as a pericardium. Okay, so what are the layers of the heart? There are mainly 3 layers: epicardium, myocardium and endocardium. Epicardium means outer layer, myocardium it's a middle muscle layer, and it's also a very thickest layer, as well as endocardium, which is the inner lining of the heart chambers. Now come to the chambers. There are mainly 4 chambers: right atrium, right ventricle, left atrium, left ventricle. So right atrium, which is receive the deoxygenated blood which is carrying from the body by the superior as well as the inferior vena cava. Now come to the right ventricle. So it pumps the deoxygenated blood to the lungs via the pulmonary artery. Now come to the left atrium. Mainly left atrium, they receive the oxygenated blood from the lungs via the pulmonary veins, and then left ventricle, which is pumps the oxygenated blood to the body via the aorta. Now come to the valves. So there are mainly 4 valves: tricuspid, pulmonary valve, mitral or the bicuspid valve, and then aortic valve. Okay, so tricuspid valve, which is present in between the right atrium and then right ventricle. So mainly it's ensuring the one-way blood flow from the right atrium to the right ventricle, which is preventing the black flow of the blood to the right atrium into the heart pump. Okay, now come to the pulmonary valve. So it's present in between right ventricle and then pulmonary artery. So in the pulmonary valve, it's also control the flows of the blood from the heart's right ventricle into the pulmonary artery. Now come to the mitral or the bicuspid valve. So it's present in between the left atrium and left ventricle. So what is happened? It's working as a one-way door which is ensure the blood flow in the correct directions during the cardiac cycle especially, and also going to prevent the backflow of the blood from the ventricle to the arterium. Now come to the aortic valve, which is present in between the left ventricle and then aorta. So it's this aortic valve, it's ensure one-way blood flow from the left ventricle to aorta, which is preventing the backflow into the ventricle when the heart muscles is going to be relaxed. Okay, now come to the blood supply of the heart. So the coronary arteries supply the blood into the heart muscle itself. So conduction system is nothing but like includes the SA node or the sinoatrial node, AV node, atrioventricular node, bundles of His and bundles of branches, as well as the Purkinje pivot muscle, which is control the rhythmic contractions of the heart. Okay, so this heart functions is a dual term functions, circulating the blood as a two-way. First is the pulmonary circulation, which is also known as a right side, and then systemic circulation, which is also known as a left side. So pulmonary circulation is nothing but it carries the deoxygenated blood from the heart to the lungs and returns the oxygenated blood back to the heart. Okay, so that is called pulmonary circulation, and it's also a very short loop function. So it's also known as a short loop function. Okay, now come to the systemic circulation. So in the systemic circulation, it's happen in the left side of the heart. So what is happen? It carries the oxygenated blood from the heart to the like rest of the body and returns deoxygenated blood back to the heart, and it's a very closed loop system. So what is happen? All the body parts or the tissues and then muscles, they are getting the adequate blood flow. Okay, so that is called systemic circulations. Now come to the next, that is ball and socket joint. So ball and socket joint is a type of the synovial joint where the spherical bone end like ball fits is a cup-like depression on the socket of another bone. So this structure, which is mainly allows for the movement in all the directions, including the rotation also. So that's why it's known as a ball and socket joint. Okay, so mainly like knee joint is known as a ball and socket joint. Okay, so see the example, see the shoulder joint like humerus and scapula, as well as the hip joint like femur, as well as the pelvis. Now come to the movements allowed. So flexion, extension, abduction, adduction, rotation, as well as the circumduction. So everything I discussed. So now circumduction, what do you mean by the circumduction? Circumduction is nothing but it's a circular movement of a limb where the distal end moves into the circle while the proximal end fixed in a one position. So this proximal end, it will rotate and it will again come back in a same point. So that is called circumduction. Okay, now come to the structure of the brain. So structure of the brain is nothing but it's a brain is a central organ of our nervous system, which is located in the cranial cavity, and it's also very much protected by the skull, meninges, as well as the cerebrospinal fluid, and it's also control the body functions, thoughts, emotions, and then sensations by the lobes of the brain. So now come to the major parts of the brain. Cerebrum. Cerebrum is the largest part of our brain, and it's also divided into the hemisphere like right hemisphere as well as the left hemisphere. And each hemisphere, they are having the four lobes. As I said, like four lobes are there: frontal lobe, parietal lobe, temporal lobe, as well as the occipital lobe. So this front part of our like face is called as a frontal bone. Then Then this part is called as a occipital lobe as well as the occipital bone in this position. Last part is a temporal bone. This two side of the last part of the brain is called as a temporal bone, and parietal bone is nothing but the two side of the brain. So if it is brain is like this, means this two side of our head is known as a parietal bone. Okay, so these are the bones. Now come to the controls, which is voluntary action, speech, memory, emotions, as well as the intelligence. So cerebellum, which is located below the cerebrum at the back of the brain, and it's also control the body balance, coordinations, and fine motor movements. Now come to the brainstem, which is connected into the spinal cord, and it's divided into the three phases. First is the midbrain, which is control the eye movement and reflexes. Then pons, which is relays the message between the brain parts, and then medulla oblongata, which is control the vital functions like breathing, heart rate, as well as the blood pressure. Means all the important vital signs of our body. Now come to the diencephalon. So diencephalon, which is include the thalamus, like relay the station of the sensory informations, and then hypothalamus, mainly it's controlling the body temperature, hunger, thirst, and links the nervous system to the endocrine system. Okay, now come to the protective covering. So there are two type of protective coverings are there. First is the meninges and second one is the CSF. Meninges is nothing but it's a dura mater, arachnoid matter, as well as a pia mater. These all are the three components of the meninges layer, okay, which is mainly covering the outer portions of the brain as well as our spinal cord. So that is called meninges. So the components of the meninges is nothing but, just keep it in your mind, dura mater, pia mater, as well as the arachnoid matter. Now come to the CSF or cerebrospinal fluid. Mainly is the it's working as a cushions as well as nourishes the brain, okay, especially the meninges. So that is the functions of the CSF. Now come to the blood supply of the brain. So it's supplied as a carotid as well as the vertebral arteries, and brain consumes a large amount of the body's oxygen as well as the glucose. So if brain stops to get the oxygen, adequate oxygen supply into the brain, so obviously at the same time the person will go for the stroke. Okay, so stroke, just remind, stroke is one of the disease which is started from the brain, then it will come to the heart. Okay, now come to the next, that is nosocomial infection. So what do you mean by the nosocomial infection? It's also known as a hospital acquired infection or HAI, and it's infection that a patient acquires during their staying in hospital or the healthcare facility which was not present or incubating at the time of the admissions. Now come to the common sites of the nosocomial infection. First is the urinary tract, especially with the catheter use. Next is the surgical wounds, then respiratory tract, as example ventilator associated pneumonia, then the bloodstream, as example the IV line or the IV related infection. Common causative organisms: Staphylococcus aureus, Escherichia coli, Pseudomonas aeruginosa, as well as the Klebsiella serosa or the spices. Okay, now come to the risk factor. First is the prolonged hospital stay, use of the invasive device, as example catheter, IV lines, etc. Then weak immune system, then poor hand hygiene by the healthcare staff. Now come to the prevention. First is strict hand hygiene, like wash and all everything, use of the sterile technique while gone for the any kind of the surgical as well as the medical procedure, proper disinfection as well as the sterilization through the autoclaving, boiling, etc. Then isolations of the infected patients were needed, as example the tuberculosis. Now see the image of the nosocomial infection during the hospital stay through the instruments, sometimes through the environment, sometimes due to some unhygienic process. It's spread from one person to another person. Now come to the classifications of the hypersensitivity. So hypersensitivity reactions is nothing but it's a exaggerated or inappropriate immune response which is called as a tissue damage. Okay, so then they are classified into the four main types based on the mechanical involved as described by the Jail and Coombs. So type 1 is immediate or the anaphylactic hypersensitivity. So it's mediated by the IgE or intraglobulin A antibodies. Mechanism: allergen, that binds to the IgE on the mast cell. So after binding to the mast cell, it's releasing as a histamine hormone. Okay, and the onset is immediate. When the histamine hormone is releasing in our circulatory system, at the same time the person will get the excessive itching sensation or the hypersensitivity sensation within a minute. So that's why the onset is immediate. So examples like anaphylaxis, allergic rhinitis, asthma, as well as the food allergy. Okay, so now come to the next, that is type 2 or the cytotoxic hypersensitivity. So what is happened, like IgG or the IgM, intraglobulin G and intraglobulin M, which is antibodies against the cell surface antigen, and how its mechanism, like antibodies that binds to the cell, then cell destructions by a complement or the phagocytosis. Phagocytosis is nothing but like when the cells like infected cells, they are destroying the normal cells as well as the immune cells. Okay, so that time it's called as a phagocytosis. So due to this the phagocytosis, normal cell destruction is happening. So that's why what is happened when it's coming and then binding with our antigen, so like proper antigen. So what is happened, histamine started to release. So after some time they will get the proper like itching or the hypersensitivity reaction. So that is called cytotoxic hypersensitivity. So just remind, cytotoxic hypersensitivity, why this name? Like cytology we know as a study of the cell, right? So cytotoxic hypersensitivity is nothing but when hypersensitivity is happening after the cell destruction. So that's why it's called as a cytotoxic hypersensitivity. And type 1, like its onset is immediate and its onset is after some hours or after some minutes. So what are the examples? Hemolytic anemia, blood transfusion reactions, Rh incompatibility, as well as the myasthenia gravis. Okay, so now come to the next, that is type 3, immune complex mediated hypersensitivity. So what is happened, like mediated by the antigen antibody complexes, IgM or the IgG antibodies. So what is the mechanism? Mainly this immune, their complexes deposit in the tissue, then it's causing factor as a inflammation. So when this antigen, they're binding with our the tissue cell as well as the layers or the muscles or tissue structure, so that time they started to release the histamine. So the tissue and that particular layers of that particular area is going to be inflamed, and so for that the hypersensitivity reactions are coming. Okay, so that is called immune complex mediated hypersensitivity. Sometimes for this kind of the hypersensitivity reactions, the people, you can see the hive, means if you scratch or something, if you pinch their skin, no, so what will happen, it will be bumped up. Okay, so inflammations as well as the swelling or like bubbles like structure you can see on their skin, rash like structure. Okay, so that is called hive, and that is also one of the main causing factors of immune complex mediated hypersensitivity. So what are the examples? Systemic lupus erythematosus, next is the rheumatoid arthritis, serum sickness, post-streptococcal glomerulonephritis. Now come to the next, that is type 4 or the delayed type or cell mediated hypersensitivity. So what is happened, it's mainly causing factors of the T lymphocyte, no kind of any other antibodies, just T lymphocyte cell. So what is the mechanism? The T lymphocyte cell, it's releasing as a cytokines hormone, and due to this cytokines hormone, inflammations and then tissue is going to be damaged. Okay, so what is the onset? Like delayed, minimum 24 to 72 hours. So what are the example? Tuberculin skin test, like as well as the Mantoux test. So that's why this Mantoux test, after doing this Mantoux test within 72 hours, we can't detect whether the person is having any kind of the disease or not. Okay, so why? Because mainly this test is happening in the night time. So night time, what is happening? The bacteria overloading is happening around the layer of the skin. Okay, so like basement layer of the skin. So what is happening when they are going for the test? So they can check the proper viral load in our circulation system. So that's why the Mantoux test is happening especially in the night time. Now come to the contact dermatitis, as example the poison ivy and then graft versus host disease. Okay, now come to the next, that is organs of the excretory system. So excretory system is nothing but like urinations as well as the motion passing, etc. So what are the organs are included in our excretory system? First is the kidney, which is mainly a function is filter the blood and formations of the urine. Then ureters, which is transport the urine from kidneys to the bladder. Then urinary bladder, which is stores the urine until the excretions. Then urethra expels the urine out of the body. Then skin excrete the sweat like butter, sage, salts, urea, etc. through the sweat glands. Then the lungs, which is excrete the carbon dioxide and water vapor. Then liver, which converts the toxic substances, as example the ammonia to urea for excretions by the kidneys. Now come to the formations and compositions of the urine. So formation of urine is nothing but like glomerular filtrations. So what is happening? It's mainly occurring in the glomerulus of the nephron part. So blood pressure, it forces the water and smaller solutes like glucose, salts, amino acid, urea from the blood into the Bowman's capsule and forming the glomerular filtration. So after that, large molecule like protein, then blood cells, which is do not pass through the glomerulus like Bowman's capsule area, because it's a like spider shape the nets like structure. It's you can see in the Bowman's capsule area. Okay, so this is mainly for the very small amount, very small solutes person, but the particles. But other than the large particles, they can't able to pass through that Bowman's capsule. Now come to the tubular reabsorption. So which is occurs occurs mainly in the proximal converted tube PCT. So it's a very essential substance like glucose, amino acid, and most of the water and electrolytes you can see, which is reabsorbed into the blood again. So after this reabsorption, it's going to be very selective and helps in retain useful substances. Now come to the tubular secretion. So mainly occurs in the distal convoluted tubule, and its additional waste product like hydrogen ions, potassium ions, creatinine, and drugs which is excreted from the blood into the tubule, and this process helps to maintain acid-base balance as well as the remove of the toxins. Now come to the compositions of the normal urine. So normal urine is about 95% water and 5% solutes. So normal characteristics of urine are nothing but like color pale yellow due to the pigmented urichrome, then odor slightly aromatic, pH is 4.5 to 8, average is 6, specific gravity 1.005 to 1.030, and volume is 1 to 0.5 liters per day. So what are the main components? Like water, solvent for the carrying waste, urea, mainly its main nitrogen waste from the protein metabolism, creatinine from the muscle metabolism, uric acid from the nuclei and then breakdown, irons as well as electrolytes, sodium Na+, then potassium K+, then chloride Cl- as well as a calcium Ca2+, and magnesium Mg2+, and phosphate PO43-. So small amounts like ammonia, hormones, vitamins, and enzymes, they are the main components. So abnormal constituents indicating the disease, as example the glucose or the glycosuria like diabetes mellitus. Okay, so when this glucose level will be excreted through the urine as a more, so that time is known as a glycosuria, and it's also indicating the diabetes mellitus. For the protein like proteinuria, when protein will be like releasing through the urine, so it's indicating as a kidney disease. Blood or the hematuria like infections, trauma, stones, etc. Then ketones, uncontrolled diabetes or the starvations, and then past cell urinary tract infections. So through the urine, if this kind of components will come, like as example glucose, protein, blood, ketones, parcels, so based on the presence of the component, we have to detect which disease is happening inside of that particular body. Okay, so now come to the muscles of the head and neck. So the muscles of head and neck, which is mainly involved in the facial expressions, mastications or the chewing, head movement, as well as the swallowing. So these are the classified based on their mainly functions and then location. So see the first muscles of the facial expressions. Okay, first is the frontalis. So frontalis mainly it raises the eyebrow and wrinkles the forehead. Now come to the orbicularis oculi. So mainly it's helpful for closing of the eyelids. Then orbicularis oris, which is mainly help to close and puckers the lips. Then bassinator, which is mainly compress the cheek as in a blowing sensation, as well as a zygomatic measure, which is mainly elevates the corner of our mouth during the smiling. Then occipitals, mainly it's helpful for the pulse cut backward, and then platysma, which is mainly tenses the skin of the neck and the lower face. Now come to the muscles of the mastications or the chewing. So for the chewing, what are the muscles are helpful? First is the masseter, which is elevates the mandible closing jaw. Next is the temporalis, which is assist in the elevating as well as the retracting mandible. Then medial pterygoid, which is helps in closing the jaw, and lateral pterygoid, which is helps in opening the jaw and moving it side to side. Okay, so that is called muscles of the mastication. So just remind what are the muscles of the facial expression, what are the muscles of the mastication. Sometimes they will ask this kind of the questions in a 2 marks also. Okay, now come to the muscles of the neck. First is the sternocleidomastoid muscle. Okay, so it's mainly turns and flexes the head, and it's also originated from the sternum as well as the clavicle, and it's also going to insert into the mastoid process. Now come to the trapezius, so which is moves the head and then shoulder, and it's also going to extend into the neck and then rotates the scapula. Now come to the supraophid muscle, so which is located above the hyoid bone, and it's also include like digastric, mylohyoid, as well as the goniohyoid. And next is the helps in swallowing and elevating the hyoid bone. Now come to the infrahyoid muscle, so which is located below the hyoid bone, which is includes like sternohyoid, sternothyroid, then thyrohyoid, as well as the omohyoid, and which is depress the hyoid bone as well as the larynx during the swallowing. Then scalene muscles, anterior, middle, as well as the posterior, which is helps in the breathing and neck flexions as well as the natural blending. Now come to the functions of a muscles. First is the movement. So muscles enables the body movements by contracting and pulling on bones. Then posture, like maintain the body positions as well as the posture. Joint stability helps to stabilize the joints during the movement. Heat production, generate the heat to maintain the body temperature. Circulations, cardiac muscle pump blood. Then smooth muscle regulates the blood flow, as well as the internal organ movements, which is the smooth muscle move food, urine, etc. via the peristalsis. Then breathing is nothing but mainly the diaphragm, and then intercostalis aid respiration. Facial expression and speech, which is muscle control expression as well as the shrinking. Now come to the functions of the liver. So first is the metabolism. So process the carbohydrate, protein and fats. Detoxification, like remove the toxin and drugs from the blood. Bile productions, like produce the bile for the fat digestion. Storage, like glycogen, vitamin A, D, B12 and then minerals or the ions. Next is the synthesis, mainly the produce the blood protein like albumin and then clotting factors. Immune functions, like helps to fight infections to the Kupffer cells, and then regulations maintain the blood glucose level. Now come to the blood groups. So blood groups are classified in the presence or absence of the antigen on the surface of the RBC. First is the ABO blood group. So group A means A antigen and B antibody should be present. Okay. Group B means B antigen and A antibody should be present. Group AB means A and B antigen should be present but no antibody should be present. Universal recipient, as well as the group O, no antigen, both anti-A and anti-B antibodies as a universal donor, it should be present. Now come to the Rh factor. Rh positive means they are having the Rh or the D antigen, and Rh negative means no Rh antigen is present. So importance is nothing but if you are not doing this the blood group matching during the blood transfusion, so there is a chance for the there is a chance for the mismatching of the blood circulation. So that time heart will not able to pump the blood properly, which is their body is needed to be adequate blood flow, right? So what will happen, brain will stop the functions as well as heart also can't able to beat properly, so the person will go for the death. So that's why importance is that's why the blood group is matching is the too much important. So during the blood transfusion, organ donation as well as the pregnancy, it's very much needed to check. Now come to the next, that is physiology of the hearing. So mainly what is happen, physiology of the hearing is nothing but how the eardrums is going to be converts into the sound waves of a electrical signals that the brain can able to detect, yes, that sound is from that object. Okay, so that is called physiology of the hearing. So mainly how it's waving. Okay, see the image. So first is the outer ear. Okay, sound waves is coming and captured by the pinna or the auricle. Okay, so after this through the pinna or the auricle, the sound waves is going to be captured. So after that what is happen is directed through the ear canal to the eardrum. Through the eardrum it's going to be vibrating. Okay, next what is happen in the middle ear, when this eardrum it vibrates in response to the sound wave, and in this vibrations are going to be transmitted into the three type of the bones, that is called malleus, incus and stapes. So these three bones they are going to be vibrated. So after this what is happen, it's going to be vibrating as well as the inner ear also. Okay, and their ossicle is present, right? So these three bones is also combinations as a ossicle. So ossicle is going to be vibrated. So after that is ossicle amplifying the sound vibrations and then transferred into the oval window, so which is connected into the inner ear sections. So after this inner ear sections, what is happen, sound vibration is waving into the cochlea part. So this part is going to be vibrated. So during this vibration, the fluid which is present inside of the cochlea, it's going to be ripple. Okay, so due to this ripple, what is happen, it's creating a traveling wave along the basalic membrane, which is where the hair cells are or the hair follicles are also going to be present. So during this wave of the sound wave, what is happen, this hair follicles as well as the basalic membrane is going to be vibrated, and due to this the movement and then vibrations, what is happen, it triggers a releasing of the neurotransmitter in our ear canal, which is generating the electrical signal, and that signal sent to our brain, and then brain can able to detect the sound from which object it's actually coming as well as from where it's coming. Okay, so that is the physiology of the ear hearing. So from the pinna, how it's going to our brain, so that is the pathway. So there are so so many structures there: outer ear, inner ear, middle ear, as well as the malus, incus, then stapes bone is going to be vibrate. After that, cochlea is going to be vibrate. After that, vesical membrane as well as a hair follicle is going to be waved. Then through the cochlear nerve or through the vestibular nerve is going, this wave is going to be triggering as a neurotransmitter like secretions into our renal, which is creating a signal, and from that through the auditory nerve we can able to detect, yes, this sound is from that object. So that is the physiology of the hearing. Now come to the C, sound wave collections. Okay, so outer ear, pinna or auricle, it's collect the sound waves which is travel through the external auditory ear canal to the tympanic membrane. Then vibration transmission to the middle ear, as I said, which is passed through the ossicle like malus, incus, as well as the stapes, and this pushes on the oval window, transmitting the vibrations to the inner ear. So sound conventions: inner ear, in vibration enter in the cochlea, which is filled with the fluid. So movement of the fluid stimulates to the cells of the organ of the cautery or the sensory receptions, and hair cells convert the mechanical vibrations into the nerve impulses. So after that, the signal transmission lies through the auditory nerve, the auditory or the cochlear nerve, which is impulsed to the auditory cortex to the brain as a temporal lobe, and then brain interprets the signal as a sound. Now come the mode of transmissions of the infection. So first is direct transmissions. So person to person contact like touching, kissing, sexual contact, as well as a droplet spread through the coughing, sneezing, etc. Now come to the indirect transmission like airborne through the dust or droplets suspended in the air. Then vehicle borne, which is contaminated food, water, blood, or the any kind of the object like fomites, and then vector one, which is via the insects like a mosquito like malaria and then dengue. Now come to the vertical transmission, so from mother to the child during pregnancy, childbirth, or the breastfeeding. Now come to the process of digestion. So first is the ingestion. Ingestion is nothing but food enters to the mouth, chewed by the teeth and mixed with the saliva, which is contained the enzyme amylase. So after that propulsion, what is happened? Swallowing or the deglutition moves food into the esophagus. So after this esophagus, peristalsis is going to be pushes food towards to the stomach. So after this mechanical digestion, so which is crunching the stomach, breaks into the food in a small pieces, and it's going to increase the surface area for enzyme to act. Okay, especially the ACL. Now come to the chemical in the digestion. So stomach, gastric juice like ACL and pepsin is going to be digest proteins, and small intestine enzyme from the pancreas, and bile from the liver, which is digest as a carbohydrate, proteins, as well as the fats. Now come to the absorption. So nutrients is going to absorb into the blood and lymph through the walls of the small intestine like villi and microvilli, and elimination, undigested food and then waste product is passed into the large intestine, water is absorbed, and feces are expelled through the rectum and then anus. Now come to the asepsis. So asepsis is the absence of the pathogenesis like disease causing microorganism, which is mainly refers as a practicing used to prevent the infections and maintain a sterile environment, especially in our healthcare settings. Now come to the medical asepsis or the clean technique. So mainly it's aimed as reducing the number and then spread of the microorganisms. So what are the method? Like hand hygiene, regular hand washing or using the hand sanitizer, then use of the gloves, mask, gowns, then proper cleaning and disinfecting of the surfaces as well as the equipment, then safe disposal of the contaminated materials like dressing needles by managing the biomedical waste management. Okay. Now the proper lining handling as well as the isolation precautions for the infected patients. So mainly it's used in the general patient care, medication administration as well as the wound cleaning. Now come to the surgical asepsis or the sterile technique, which is aimed at eliminating all the microorganisms including spores from an area or the equipment. So method: sterilization of the instrument like through the autoclaving, surgical hand scrubbing by the staff, use of the sterile gloves, gowns, mask and then drips, creating a sterile field during the surgeries or the invasive procedures, strict no-touch techniques and used in the operating rooms, catheter insertion, wound suturing as well as any invasive procedure. Now come to the conduction system of the heart. So this conduction system of the heart is a specialized group of the cardiac muscle cells that generate and transmit the electrical impulses, which is mainly ensuring the coordinated as well as the rhythmic heart contraction or the heartbeat. So main components of the conduction system is nothing but sinoatrial node or the SA node, node. It's also known as a pacemaker of the heart, which is located in the right atrium near to the superior vena cava, and it also generate the electrical impulses automatically, sets the normal heart rate, as example 60 to 100 beats per minute, and impulse spread through the artery as well as causes the arterial contraction. Now come to the atrioventricular node or the AV node. So for this, it's mainly located in the intra-arterial septum near to the tricuspid valve, and it also receives the impulses from the SA node. So it delays the impulses slightly to allow the complete arterial contraction before the ventricular contractions, and it acts as a backup pacemaker, as example like 40 to 60 beats per minute. Now come to the bundle of the Hitch or the atrioventricular bundle. So what is happened? It's mainly arises from the AV node. So it passes through the intraventricular septum, and it divides into the right as well as the left bundle branches, and it transmits the impulses to the ventricles. Now come to the right and left bundle branches. So mainly it's run along with the right and left side of the intraventricular septum and carry the impulses towards the apex of the heart. Now come to the Purkinje fibers. It's spread through the ventricular walls, and it's mainly ensure the rapid conductions of the impulse to the ventricular muscles and cause the ventricular contractions as the apex upward, and which is mainly causing factors of the efficient pumping of the blood. Now come to the next, that is functions of the blood. First is the transport. So oxygen from the lungs to tissue is going to be transported through the blood, then carbon dioxide from tissues to lungs, then nutrients from digestive system to cells, hormones from the glands to target organs, and waste product from kidney and liver for the excretion. Now come to the regulations, mainly body temperature through the heart distributions, pH balance using buffers, fluid balance by maintaining the osmotic pressure. Now come to the protections like WBC, which is fight infection for the immunity, and then platelets and then clotting factors, which is prevent the blood loss, as example the clotting, and antibodies neutralize the pathogen. Now come to the classifications of the bacteria. So mainly this classification depends based on the some variation. First is based on the shape. First is the cocci shape, like spherical, staphylococcus, bacilli, rod shape, it is the E. coli, then spirilla, spiral shape, that is the spiralium, then vibrio, coma shaped like a vibrio cholerae. Now come to the based on gram staining. So gram positive like a retin crystal violet stain, that is purple, and then gram negative do not retain any stain like a pink or red color. Now come to the based on oxygen requirements. So aerobic means required oxygen, anaerobic grow without any oxygen, especially in the nitrogen, mainly they can also able to grow up. Then facultative anaerobes, which is can live with or without oxygen. Now come to the based on temperature performance, like a psychrophiles, which is cold loving, then the mesophils, which is a moderate temperature, and thermophils, which is a heat loving. Okay, now come to the epithelial tissues. So epithelial tissue is nothing but it's a type of the tissue which is mainly cover the body surface, then lines the internal organs and cavities as well as forms the glands. So what are the types? Based on the shape and layers. Based on layers, like a simple epithelium, which is a single layer, and stratified epithelium as a multiple layer. And based on the cell shape, like a squamous flat, then cuboidal, cube shaped, columnar tall, and then columnar like, and then ciliated with a hair like projection like a respiratory tract. Now come to the pancreas. So pancreas is a gland which is mainly located inside of the abdomen, that functions both as an exocrine as well as an endocrine organ. Okay, so that is the pancreatic structure and then functions images. Okay, so mainly this yellow color structure is known as a pancreas. So there are some structure is there that shape is known as a pancreatic duct, as well as this is the acinar cells mainly, which is helpful for absorbing the nutrients from the food, and then islets of the Langerhans, which is the main glands for the insulin productions. So through this the islets of the Langerhans cells functions, we can able to know whether the person is a diabetic or pre-diabetic or anything. Okay, so these are the functions of the pancreas. Now come to the synovial joint. So this is a freely movable joint where the bones are separated by a fluid filled synovial cavity, and which is mainly allowing as a wide range of the motion. So that is called synovial joint, like a knee joint as well as a shoulder joint, etc. Okay, so see this image, there are the two bones, and in this bones there are some space are there which is filled with a fluid. So that is called the synovial fluid, and this membrane is called as a synovial membrane. So this outer portions of the two bones which is joined, this ball and socket joint is known as a capsule of the joint, and that is the synovial fluid. So that is the synovial joint. Now comes the structure of the ovary. So see the ovary is structure. There are so many parts are there in the ovary, like a germinal epithelium layer is the outer layer, then blood vessels are there, corpus albicans are there, corpus luteum is there, then cortex are there, then secondary ovarian follicle, primary ovarian follicle, oocyte is there, ovarian follicle, Graafian follicle is there. So if these all are the main components of the ovarian structure. So see the outer cortex, mainly it's contain the ovarian follicle which is various stages of development. It's a main site of the oogenesis or the egg formations, and it's also going to produce the estrogen and progesterone. Now come to the inner medulla, which is mainly contains the blood vessels, lymphatic vessels as well as the nerves, and it's also provide the support and nourishment to the ovary. Now come to the germinal epithelium. So this is the most outermost layer of the simple clevoidal epithelium. So it doesn't give rise to the despite of the name. And then tunica albuginea. So mainly it's a dense connective tissue layer which is beneath the germinal epithelium, and it also protect the inner parts of the ovi or the ovary. Now come to the cold chain. This is one of the most important questions, especially for the 2 marks. So cold chain is a temperature control supply system used to store as well as transport the vaccines, then medicines as well as a perishable biological product which is a recommended temperature, as usually plus 2 degrees Celsius or to plus 8 degrees Celsius for maintain their potency as well as the effectiveness. So key components, cold storage components like a refrigerator, freezers, then transport contents like a cold boxes, vaccine carriers, etc. Monitoring devices like thermometer as well as the data loggers. So what are the importance of the cold chain? Ensure the vaccine potency, prevents the wastage and ineffective immunization, and maintains the public health standards. Now come to the physiology of the respiration. So first is the pulmonary ventilations, means breathing. Okay, so first is inhalation. So during this inhalation, what is happen? Diaphragm and then intercostal muscles is going to be contract. So after this contractions, lung is going to be expanding, and due to this expandation, air is coming and entered into the lungs. So after that exhalation, muscles is coming in relaxing, then lungs is going to be again recoil and air is pushed out. So now come to the external respiration, which is occurs in the lungs, and oxygen it diffuses from the alveoli to the blood, and carbon dioxide diffuses from the blood to alveoli, means opposite direction. Now come to the transport of the gases. So what is happen? Oxygen is carried by the hemoglobin in the RBC, and carbon dioxide which is carried in the plasma as bicarbonate and bound to the hemoglobin. Now come to the internal respiration. So mainly it occurs as a tissue level, and oxygen which is moves from blood to the body cells, and carbon dioxide moves from cells to the body. Now come to the cellular respiration. So oxygen is mainly used by the cells for producing the energy or the ATP, as well as carbon dioxide is a waste product. So thank you. I hope you all understood my session. In this session, I discussed so many important topics which will be helpful for your crack the exam. Again, we'll meet in next session. Till that, keep learning and stay tuned with the easiness. Thank you.